Welcome back, everybody. We're winding down our Arthritis Broadcast Network booth with a very special interview with Eileen Davidson, patient advocate and member of the Arthritis Patient Advisory Board at Arthritis Research Canada, along with myself. So we are very familiar with each other, but what we would like to do is get you familiar with Eileen. So Eileen has a couple of diagnoses and she's very active in the community, has a wonderful blog, and
a wonderful son.
And a wonderful son, yes. So if you could maybe tell us a little bit about your diagnosis history and how you, and quickly it would seem because you've done so much, transitioned into patient advocacy.
Well, I was diagnosed at 29 with rheumatoid arthritis. And it was actually myself that asked to be tested for it because my aunt had the disease. So I kind of had an idea of what it was, but being that I was only 29 at the time and was told that I had carpal tunnel, but when I had my son, I was off work for a year and the carpal tunnel didn't get better. In fact, it got significantly worse. So I decided to walk into my doctor's office and say, I want you to test me for something other than carpal tunnel, particularly rheumatoid arthritis. And I was right. The test came back positive, and that was the embark of my journey through chronic illness. And it was about a year after my RA diagnosis that they found that I had osteoarthritis as well. And that's kind of when I really kind of became confused about what was going on with my body, because I was like, why do I have so much arthritis, especially osteoarthritis? As at that point, I was 30, so I didn't think that I would be saying goodbye to my 20s and saying hello to arthritis in my 30s. And most people around me also were like, you're too young for this, you're too young for this. But the reality is there's people who are significantly younger than me diagnosed with these, and the impact it has on our lives when we are diagnosed is pretty devastating, because when I was told that I had rheumatoid arthritis is also when I had to stop working as an esthetician. So I was introduced to disability, and I was really frustrated and really bored. And I just wanted a way to kind of make sense of everything that was going on with me. And I've always been, I guess, kind of passionate about writing. So I started to, as I say, complain on the internet about what was going on with me. And I started to get a little bit of attention from people, particularly Facebook friends. They're like, you should start a blog. So I was like, oh, I don't know. That sounds like a lot of work. It sounds, kind of vain. And so I went for it.
Don't you think it's also a really good way to download how you're feeling and get it off your mind? And can be very therapeutic and cathartic to get that out there. And then when you find out it's actually helping other people, it just snowballs.
Yeah. So at first I was really kind of fueled by the messages that I was getting from other people when they were saying, I relate to so much what you're saying. I've never heard anybody else say what you said. Even though this information is all over the internet, there's so many other advocates, but it's kind of harder to find. But
I think it's finding the voice that resonates.
It is. It definitely is. And there's lots of organizations that are picking up people who are writing about their struggles with illness, especially bloggers like myself, to share our experience, because we are a wealth of knowledge, just like the rheumatologists. For people who, especially, even if they're not just been diagnosed, it could be they've been struggling for a long time and they haven't had a substantial flare or something. So we can help so many different types of people living with arthritis, and that kind of really sparked the advocacy side in me. And then I decided to see how I can get more involved with this. I said hello to the Arthritis Society, became one of their ambassadors. That was my first step, and I started getting involved with their fundraising, their walks, and volunteering with them. And I decided that, or I felt so much good come out of volunteering, that I was like, how can I do more? How can I do more? And that's when I met you, and you introduced me to the Arthritis Research Canada Patient Advisory Board. And that's when I really kind of discovered how the health research process is, and how I can use that for myself, but also help other people through the knowledge that is being done, particularly within Canada and the research. And so that was a major step for me and my advocacy.
And we should plug the CRA because we met at a CRA.
Yes. So
2 years
it was the one in
at
Vancouver,
a focus group that
and
was a
you saw
side.
me.
Yeah.
You saw me there, and I was saying stuff about how it was so hard to live with fatigue and invisible illness and everything, and you recruited me there, and they haven't been able to get rid of me since. So.
Well, I just wanted to say we've been enjoying having you on the board.
Thank you.
I think for any patient that decides to get involved, that there's a couple of the struggles are, because it's so inspiring, is learning to say no.
Yeah.
I find that's one of the early ones to learn, because you want to be involved and you want to help and you're inspired and you see all these, you see the researchers and people behind the scenes that are working every day to help make our lives better, that you want to be part of that.
Yeah.
The fact that you have a voice in that you can express, because you know, when you're out there in the community and you see what the concerns are and you can bring those back to the research, it just reflects so much better for what the benefits are to our community.
I definitely know that research has benefited me in so many different ways, from learning how to properly exercise with rheumatoid arthritis, to finding out answers, debunking myths that I hear, to even just learning how to stay organized when you live with chronic fatigue and you're going through disability, so you are left with days where you don't have anything to do, and it gets boring. So it gives me something to do. It gives me that feeling of giving back to the community, and that I have a purpose in all of this. And so being involved in the research has been a real big learning curve for me to manage my disease, but also grow as a human.
And let's segue into that journey along with being a single parent.
Yeah, so my son was 2 years old when I was diagnosed, and that was definitely a challenge, because the energy of a toddler and chronic fatigue definitely don't mix at all. And all the volunteer work that I do, I bring him with me. He sees it all, and he's actually started to get really passionate about being involved in all these things, and his understanding of arthritis is amazing, and he's really compassionate. Like, even his principal told me, like, he's so compassionate and like kind to other children that normally get kind of bullied because they have a disability or they have something wrong with them, but he sticks up for them and he's kind to them and he's willing to be their friend. And I really think, like, my experience with pain and fatigue and everything has kind of shaped him into a really just wonderful little human, even though he's only 7 now. There's lots of time to change, especially with the terrible teenager years coming up, but so far so good.
I think it's been, a lot of people will try to probably shield their children from a lot of it, and there are a lot of negatives that, yes, you would want to, depending on the stage of life the child is in.
Definitely.
But I've personally seen the little man that you have, and how compassionate he is, and how he thinks being kind is cool.
Yeah.
And what he's learned from being exposed to Cassian friends, especially because he attends those days with you.
Yeah.
And he sees that, you know, younger children, he's very fortunate that he's healthy, and when he has perspective at 6 years old, your son has perspective.
Yeah. And that's been an experience that a healthy mother would not be able to give to their child. So in some ways, there are benefits to being chronically ill. And yeah, like, I can't hide it from him all the time, because there's times where he's just like, let's play, Mom, let's play. And I'm just like, I can't even stand right now. My feet are burning. Let's try and maybe cuddle on the couch and watch a funny movie or something. And there's a lot of mom guilt with it, but...
Of course.
You know,
a little?
I guess, like a mountain of mom guilt, but that's okay. It just is what it is, and he doesn't know any different, and he's still happy.
Which is the most important thing.
Yeah.
And that also is talking about guilt. I think That's something that doesn't get discussed a lot. It gets discussed in blogs, it gets discussed in closed support groups online, and when you're newly diagnosed and you're not used to feeling the guilt of not being, and the grief of not being the person that you are and not being able to do what you do, and having to retrain yourself on pacing yourself and being kind to yourself, but there's still guilt that comes. I mean, I'm 8 years in, and you know, when I can't have my apartment in a state that I want to have it, or if my brain wants to do an activity or go to something social and the body is not able, you know, there's some grieving and there's some guilt that goes along with that.
Well, unfortunately with chronic illness, the grief process kind of never really ends. No. We just kind of develop really good coping skills with each loss or thing that kind of comes up. And it comes up in little tiny ways consistently.
Or we don't cope. We have a little mini meltdown, and we move along. We don't live there.
But there's no shame in ripping your hair out for 5 minutes and having a little meltdown, and then just taking a deep breath and going, okay, this is my now. How can I move forward?
There's sometimes I take a day.
I will need a week sometimes. Maybe more.
Yeah, so it's, you know, we're snowflakes, right? Sometimes you need a day just to feel your feels and then, you know, get along.
Well, I believe that, I know that depression and anxiety are major components of living with probably any chronic illness, but particularly for me with rheumatoid arthritis, I noticed that is one of the most difficult symptoms to treat, and I'm very thankful for my social worker who has helped me along the way. I go to a Mary Pack arthritis program, and just finding ways that I can keep positive and finding new things to keep myself busy with, and really honestly volunteering is something that I really love to do, and writing and just expressing myself. At first I was so scared to put myself out there, everything wrong with me. I thought I would be judged, bullied, and everything, but instead I've been celebrated for it.
And starting small, I think, is key for anybody that's thinking about getting into it.
Yeah.
Dip your toe in, do what you can do, and the learning, I mean, you learn so much if you're someone that likes to learn. That really, on the days that I'm feeling guilty about what I can't do, I try to remind myself of the things I can do, that I'm doing that I didn't do before, that my friends aren't doing, or people that I know in my circle that they aren't able to do, because when you're working full time, you know, and you have a family, and that's just, there's so little time in the day that every little bit helps. So
and celebrate your victories.
Yes.
Like for me, I could just be really excited that I was able to do 30 minutes on the elliptical, or I could just get a little excited that my article got shared a whole bunch. Just always celebrate the little victories and focus on the positive.
And on that note, Anita, do we have any questions from the audience?
Well, the first one is for Eileen. How do you balance the different topics covered on your blog? And do you have a specific topic you love most?
Well, how do I balance is I listen to my community and their needs, and I live all of this, so I just try to put everything that I am dealing with into words, which can be difficult. And my favorite topic, I think, well, it's I've written off for Creaky Joints about it. It did quite well. Is how to explain rheumatoid arthritis to somebody who doesn't go through it, because it is incredibly difficult to explain something that is invisible.
And the second question is for both of you. What do you enjoy doing most as a member of the Arthritis Patient Advisory Board of Arthritis Research Canada?
Give back to others.
Yeah, it's that, and it's really seeing the value from the researcher's standpoint and being involved in, I mean, I didn't realize the scope of what the involvement I was going to be in. I really didn't know. And now, you know, to be involved in a project from pre-grant phase through dissemination at the end of the project, and where you're involved along the way, and where you're able to make sure that what they're doing is understandable to patients, is relevant to patients. I think it's so inspiring, and I don't know how I'm ever going to be able to stop if I ever have to stop. It's very addicting, and the appreciation level at Arthritis Research Canada from the researchers is, like I said, it's the little things, and their appreciation level on what we add to their projects is immeasurable.
Mm-hmm. Like, it's kind of scary to go into a room and tell people everything that's wrong with you, but they're so understanding and so compassionate, and they're looking to find solutions for us. So it's not complaining, it's not whining, it actually brings a lot of validation to what we're going through.
Great. Is there any more questions?
And if you want to find me, just Google Chronic Eileen, that's Eileen.
And we are at Arthritis Research Canada. We have a new research education series that's on our website, and our biographies and what we do on the patient advisory board is you're able to find it at arthritisresearch.ca.